And get started. Thank you all so much for being here. I'm watching the attendee list as everyone signs on, and I'm just so excited for all of the different folks that we have joining us for this discussion on universal school meals and removing barriers to access in Massachusetts. If we could move to the next slide, just show you quickly our agenda for the day. My name is Jennifer Lemmerman. I am the Director of Government Affairs here at Project Bread, and I am thrilled to be joined by several wonderful guest speakers who will each give some remarks about why this is such an important effort and initiative to bring here to Massachusetts and why now is the right time. But before we do that, I do want to do just a couple of housekeeping pieces. If we could move quickly to the next slide. So some housekeeping for you. As you can tell, we're in a webinar format right now. We have lots of people on the line, and we want to make sure that we are getting to as many questions and answers at the end as we can. So in order to do that, we just want to make sure that everybody knows that you can either raise your hand or you can submit a question right into the Q&A section. We will get to as many questions as we possibly can at the end of the presentation. We also will pose some questions to you. So if you're interested in weighing in on any of those questions, you simply hit the raise hand button and we'll know that you're ready to speak, and we will unmute you, and we'll love to hear your input on these or anything else that you'd like to pose in this discussion. Additionally, if either of those don't work for you, please feel free to email actionteam@projectbread.org and we'll get those questions. Finally, I just want to mention that we are going to record this, both so that you're aware of that, but also so that you know that this is going to be available later. If you have coworkers you'd like to see this information, we will make sure it's available to everyone. So thank you for letting me get that out of the way. So let me kick off the more exciting part of the agenda, and I will hand it over to the Project Bread President and CEO, Erin McAleer.
Hi, everyone. Good morning. As Jen mentioned, I'm Erin McAleer, President and CEO of Project Bread. Thank you all for joining us this morning and for this exciting conversation. So many people here today are longtime partners who Project Bread has worked with on important legislative issues and programmatic work, but we also have a lot of new faces. Today, we have representatives from the medical community, from schools, from the food system, from social services, research partners, anti-hunger advocates, and members of broader advocacy communities. As you all know, we're facing an unprecedented rise in food insecurity due to the coronavirus pandemic. Today, 1 in 5 kids in Massachusetts are food insecure, and we know that Black and Latinx families are disproportionately impacted. This crisis has shed a light on the state of hunger in our state and in our nation, but we always knew that this was a crisis. Even before this pandemic, too many people in our state were struggling to meet their most basic of human needs, food. And kids have always been one of the groups that are most detrimentally impacted. When the stay-at-home order was issued in March and schools across our state were closed, a spotlight was shown on the importance of school meals and anti-hunger work. For low-income kids, over half of their daily calories can come from school meals. In the spring, the federal government approved and the state implemented a system to make accessing these meals as easy as possible with a number of different measures. One of those was making these meals universally free to all students aged 0 to 18 in Massachusetts. And this is the system that will remain in place until the end of the school year in June. But we all know that even once we have a vaccine and we're on the road to economic recovery, it's going to be a very, very long economic recovery. Many families will be facing different circumstances on the backside of this pandemic, illness, lost jobs, and it's going to impact their economic ability to purchase food. This will be true in every corner of our state, every single town, every single school district. Since post-World War II, we've had a system in our nation and in our state that creates tiers for school meals. Some kids pay full price, some kids pay reduced, and some kids are free. It's the system that each of us on this call have always known. But today we're asking you to imagine a new system, one without paperwork to show your income, one without student meal debt, one without stigma, and one that is equitable. In our nation and our state, we provide free public education. We provide free books from the library for kids to learn. We provide free Band-Aids from the nurse's office when our kids get injured, but we charge for food when we know that a child who is hungry in the classroom simply cannot learn. So today we're asking all of us to think about breaking down that barrier and erecting a new system with free, universal, and quality school meals. I know this is big. I know it will cost money, but I also know that kids who receive both breakfast and lunch are more likely to graduate high school. They're less likely to have diabetes. Food is the most basic of human needs. We've recognized that it's fundamental to learning, and we also recognize it as a social determinant of health. So while it will certainly cost money up front, the return on investment will show in education, economic, and health outcomes. Budgets are a statement of our values. Let's invest in hunger in a systemic way. I'm so hopeful and excited for the possibilities presented by this campaign, because there's a greater understanding than ever among the public and by those making policy that we need big, bold solutions and the political will to implement them if we're going to solve the most solvable of problems, child hunger. But I also recognize that we have work to do. We need to be innovative and strategic. We need to address quality as well as access. We need partners like each of you to accomplish this, which is why I'm grateful for each of you for participating today to provide questions and feedback early in this process. Project Bread is fully committed to this effort, and I sincerely believe Massachusetts can be the first state to fully implement universal free quality school meals. Massachusetts is home to the first public school, the first public library, even the first school breakfast program. We've always been the national leader on healthcare access and healthcare cost containment. We should also lead in supporting systemic efforts to address hunger as the public health issue it's always been. So today I'm hoping you'll share feedback, questions, concerns, and then work with us to build this effort together. So thank you for joining us today, and we really appreciate you being part of this effort. Jen, I'll turn it back to you.
Thanks so much, Erin. And for our next speaker, I'm so excited to introduce somebody who, for those of us who have worked together on Breakfast After the Bell, on community eligibility provision and school meal debt, really needs no introduction. State Representative Andy Vargas. Representative Vargas, as I mentioned, is the lead sponsor on both of those pieces of legislation. He's an enormous champion for anti-hunger efforts. When we brought this conversation to him originally, he did not skip a beat in his understanding of why this would be so important for Massachusetts. And I'm thrilled to have him here today to discuss his view of this issue from the legislature. Representative Vargas.
Thank you so much, Jennifer, and thank you, Erin, and to everybody who's tuned in here today. It's wonderful to be here with you all. To borrow from a song that I really enjoy by Ed Sheeran and Andrea Bocelli, Perfect Symphony. I think the folks on this call can perform a perfect symphony next session to move the agenda forward for food insecurity in the Commonwealth. So thank you all for being a part of that symphony, whether you're an advocate for school nutrition or a doctor, a healthcare professional, or an educator yourself. We need everybody involved in that symphony to actually pass comprehensive legislation here in the Commonwealth. And that's how we did it for Breakfast After the Bell. And that's how here in Haverhill, we incorporated a community eligibility provision, which now is allowing every single student to have universal free breakfast and lunch in Haverhill. And by the way, Haverhill's just around 55% or so low-income students. So if we can do it here in Haverhill, there are tons of places we can do across the Commonwealth. And I know that we can do that with all the folks that are on this call here today. Look, we knew hunger was a crisis in the state prior to COVID. The pandemic just further illustrated an issue that many of us are already aware of and brought more people into our tent to realize how many people were A, already hungry, and B, even more hungry now with this pandemic. And I know that my colleagues in the legislature understand this. They know that we're in a crisis, and that's demonstrated through the budget that we just put together, funding line items like NEFAP at historic highs. We know that there's going to be an inertia, there's going to be a force and a will to actually do something further about food insecurity next session, but we need you guys to get involved to make that happen. We know that the federal nutrition programs are critical to Massachusetts because they can scale up when we need them, they're sustainable, and as the state grapples with the economic implications that we're under through this pandemic, those federal dollars are crucial to making sure that we can close budget gaps, particularly in school districts already struggling to get by. So the question is, how can we maximize those federal dollars, the ones that exist right now, but also how do we ensure that Massachusetts is in a place to benefit from the programs that will be created under the Biden administration? How do we get a step ahead of other states that frankly are a couple steps ahead of us in some categories. This is Massachusetts. We lead the way on so many other issues, and it's time for us to lead the way on food insecurity. And I know that we can do that with everybody on this call. And look, the bottom line is this, right? We committed in this country, in this state, to public education. We said every single student, every child has a right to be educated. And we don't think twice about providing textbooks. We don't think twice about ensuring that there are teachers in the front of the classroom. We know that those things are critical to a student learning, but we know that food is also critical to a student learning. And so why haven't we guaranteed that yet? That has to be a part of our promise to ensure full and quality education for every single student. And so that's what we can do with this coalition that is forming here. I'm so excited and fired up for next session. It's been a pleasure working with you all on Breakfast After the Bell and community eligibility provision, because there are so many more things that we can do together to make sure that nobody goes hungry in the Commonwealth. No student has to worry about their food in their stomach instead of the text before them in their classroom. So thank you all so very much. I'm committed to this fight, and I look forward to next session.
Thank you so much, Representative Vargas. Thank you for your ongoing advocacy and your championship of these issues and your partnership with all of us, many of us here on the call today. We really appreciate it. Next up, we're going to hear from the school side, the school perspective on this issue. And we're joined today by Chetna Namey, who works at Codman Academy as the partnership directors. And Codman Academy, located in Dorchester, I know many people are familiar with, currently serves breakfast and lunch 100% free to all of its students. And so we know that Chetna can bring a really interesting perspective on what that has meant. So Chetna, thank you so much for being here.
Well, thank you, everyone. Thanks, and I'm grateful to be part of this this group, this team in collaboration. Thanks, Erin and Jennifer, for inviting me. I cannot stress the importance of. I'm actually a big believer in what we are doing right now, but I'm going to quickly introduce myself. I'm the partnership director for Codman Square Health Center and Codman Academy. As well as for the larger Dorchester community. We try to bring in as many partners as we can for promoting health and well-being for our Codman community, which includes Codman Academy students, families, as well as the health center patients, which we know the population actually mirror each other. And I come from a background of as a public health epidemiologist, and have worked at CDC with Division of Nutrition and Physical Activity, and at Wisconsin and Maryland Health Department. So I feel like now I am where the rubber meets the road, where we really know what those numbers really mean, whether it's the food insecurity or whether it's the access to any kind of health and prevention services. We are where we can see the real difference on the ground. And for that reason, I feel like it's so important that every school becomes its own example of how we can make a difference in reducing disparities at every level. I am actually going to say, I'm from India. I grew up in India, and there's a big saying in India that if you don't worship your stomach, your brain will not love you. And I almost feel like it applies to everything. A healthy child is a well-educated child. That's the whole essence of this. And when we say healthy, we are talking about healthy, nutritious meals and not just access to food. And I think that's where I was thinking about it, is that the whole, for us, the whole premise of providing free meals to Codman Academy students is not just that we are feeding them, but we are actually feeding them nutritious meal. And we all know that parents of all socioeconomic background, everyone needs that support in terms of feeding your child in a well-balanced nutrition way. So our school actually does have free meal for all 100% of the students. We have seen the impact of it. We have seen that how our cafeteria, our dining halls are the way where all 160 some students come together. We have a policy of where our staff actually joins in. I mean, in good old days when we used to be sitting around the dining rooms and dining halls, we have seen the impact of it, because we believe that food is prevention. the very first step. Healthy nutrition is the very first of prevention. And we also know that removing that barrier where students don't have to go through the rigmarole of proving their ID or who their parents are should not decide if they get the food or not. I think that's the essence of this whole thing, is how much a parent makes. If we want to reduce and remove disparities, let's remove it by actually creating access to the very basic need of humankind, right? Food. And I think that's where we strongly believe. We also are big believers in really connecting our students to where food comes from. That's why I'm actually also farm to school project coordinator, and we have a beautiful urban learning garden. And we feel like when we remove those sort of bureaucratic red tapes of seeing whose income is in what level, we are creating a common ground for learning. We are creating a community where we are not judged by what our parents' income is. And of course, in Dorchester, it's a different story. We do feel like this has gone a long ways. One example I can give is that our school was actually very actively involved in implementing breakfast after bell, and we actually call it extended breakfast because we realized that many of our students, especially high school students, are taking public transportation. By the time they get to school, a lot of times they are rushed and they just haven't had any food. So our food service director and our farm to school team actually now have extended the or at least in the regular school days, we extended breakfast by 45 minutes after school started. And our participation in breakfast went literally from 15% to 85% within 30 days. Students were stopping by, teachers knew that we are, so the thing is that just what we need to realize is that just making free meals accessible to all doesn't mean, I always feel like creating access doesn't mean that it's being used. So there lies another whole task saying, once we create free meals, access to free meals, our students are actually going to use it because we all are aware that their food also gets wasted in schools at pretty good percent. So, but our breakfast was being cooked warm, healthy muffins and healthy egg sandwiches, all created on site from scratch. And it actually was probably one of the most eye-opening and most rewarding experience of the work we have been doing so far, is that besides the lunch meals, we were able to increase our student participation in breakfast. And of course, we know that it is a source of comfort, a safe space, a space to connect not have some of the students in different schools. I have 2 kids in public school, and I know that most of the time I pack lunch for them, but I don't want that barrier. I'm speaking as both as a mother, as somebody who believes that public health is essential element of schools, and this is true public health. This is where we are reducing and taking care of some of the disparities and visibly visible disparity that can be solved by just cutting out the extra paperwork or extra requirements. And just one last thing I will mention is that in these pandemic times, our school sort of jumped in right away, as many other schools, I'm sure. We are feeding almost 80% of our students by having pickup time between 11 a.m. and 3 p.m. And of course, our school has no ID required. You don't have to prove you have a kid at home. And our health center population, which is right next door, has been really utilizing this resource too. And we know that food insecurity lurks in places we can't see. So yes, I am actually honored that I'm part of this this effort and share this information with you. So happy to share something more later on if anybody wants to. Thank you.
Thank you so much, Chetna. That was really helpful perspective. It's really interesting to hear what's happening in Codman and the benefits that you've seen and how that's working. So as Chetna mentioned, if you have additional questions, we hope that folks will ask them after the presentation. And Finally, we have one more guest speaker for you all today with a view from the medical community. A great friend of Project Bread, Ron Kleinman, who is the chair of the pediatrics department at Mass General Hospital, wanted to be here today. He's excited about this campaign. Being the chair of pediatrics at Mass General, you can imagine he is extraordinarily busy right now with the COVID-19 crisis and got pulled into a meeting. So he did send a message for us to play today.
Good morning, and thank you to Project Bread for pulling together such a broad and impressive group of stakeholders to talk about moving child nutrition programs forward in our state. My name is Ron Kleinman, and I'm the chair of the Pediatrics Department at Massachusetts General Hospital. I'm very sorry that I can't be with you live today. As you know, coronavirus is surging in our state right now, and there's much going on at our hospital that I need to be part of. As we deal with the medical side of this pandemic, we also know that there are long-term and very serious economic consequences as well. As you've likely heard, 1 in 5 families with children in Massachusetts now report that they're having difficulty affording enough to eat. And children are among the most vulnerable to the long-term impacts of food insecurity. Poor health outcomes, more visits to the school nurse, more absences, lower academic achievement, all of these are associated with going to school hungry. And we've seen all of those in the patients that come to visit us at the Mass General Hospital for Children. During this crisis, our country has stepped up for all kids, ensuring that children up to ages 18 can get breakfast and lunch at no cost. This is happening because we know how important proper nutrition is for kids during a crisis, as well as in their everyday lives. And while this pandemic has highlighted the issue of childhood hunger, it was already a crisis in our state that can only be addressed through sustainable, systemic solutions. In the past several months, we've temporarily removed the barriers of cost, stigma, and access to food, and we can't put them back up. We need to make sure all kids have access to school meals if we're going to end childhood hunger. I know how important this is for the children that we work with, and I'm very excited to work with Project Bread and their partners to make this a reality in Massachusetts. Thank you very much.
And we send our thanks to Dr. Kleinman for his support of this and of course for all the work that he's doing. So now we'll move to our slides and we'll take some time to walk through what we see as some of the options here in order to reach this goal. And then we'll open it up for questions. So to just set the stage a bit, I really echo much of what Erin said in her opening. You know, our values here is that no one in Massachusetts should go hungry, especially children and teens, and especially during the school day. So we know that children are particularly vulnerable to the negative effects of food insecurity, and one of the places that they most clearly struggle as a result of that is in the classroom. We feel that no child is required to pay fees at public school, and they shouldn't have to pay fees before entering the cafeteria. It should be no different. Guaranteeing universal access to school meals is an investment in student academic success, in their socio-emotional development, and in their short and long-term health. And to ensure children truly have equal opportunity to thrive, we must ensure that the right to food for all Massachusetts children is available. The classroom or the school cafeteria is the place that we can do that through school meals. On our next slide, I am going to turn it over. We have with us today, Liran Mintz is the manager of public policy and research. He has been doing an incredible amount of research into this legislation and the possibilities we have here in Massachusetts, and will walk through for us what we see are the levers that can be pulled to make this happen. Liran?
Great, thanks, Jen. So before we talk about the problems contributing to low school meal participation, we wanted to walk through how school meals traditionally work. Historically, parents or guardians have had to fill out an application and provide household financial information, qualify for free or reduced price school meals. Schools have to make sure families receive these applications, fill them out, and return them. This all contributes to the administrative cost of school meals. On the screen, you can see the guidelines for each category, as well as the amount families within each category must pay for school meals. Lowest income households are eligible for free school meals for their children. Households just above that threshold may qualify for reduced price meals, which are 30 cents for breakfast and 40 cents for lunch. All other households pay the full price for school meals. Full price meals vary, but are typically between $2.50 and $3 for lunch and around $1.50 for breakfast. For reference, the MIT Living Wage Calculator predicts a household of 2 working adults and 1 child needs to earn over $81,000 annually to meet cost of living in Massachusetts. This income is 375% of the federal poverty level, or twice the maximum income for reduced price meal eligibility. For students who do not qualify for fully subsidized free meals, their guardian must add money to their school meal account. This is often an online platform, but schools are required to have a way to receive cash or check to add to these accounts. When a student goes through the cafeteria line, a fee for their meal is charged to this account. Different schools have different approaches to a negative meal account balance. While the overwhelming sentiment is that hungry students should be fed, unpaid school meal debt can accumulate and be a burden on both schools and families. Unfortunately, this has led some districts to adopt approaches that increase shaming and stigma for students, such as throwing away a hot meal and replacing it with an alternative meal. So the problem is that kids are going hungry. In the absence of universal school meals, we notice a number of things. First, to set the table, we know that childhood hunger was far too high before COVID-19, but it's much worse now. We know this problem will unfortunately persist as we recover from the economic and health crisis. Before the pandemic, 1 in 10 children were food insecure. We now estimate 1 in 5 households of children are struggling to have enough to eat. Before COVID-19, school meals were underutilized. Less than half of free and reduced price eligible students ate both breakfast and lunch on an average day. Since families are required to pay different amounts, school meals have a reputation of being primarily for poor kids whose parents may not have the time or funds to pack meals from home. Just over 5% of students paying full price eat both school breakfast and lunch daily. That means, unfortunately, school meals carry with them the label of being poor, a label that brings shame and stigma for far too many children and can be enough to lead some to skip meals despite being free or reduced price eligible. In the case of households that do need to pay for reduced price or full price fee, cost can be a barrier. The National School Lunch Program thresholds for free meals have not been updated for years and fail to account high cost of living in states like Massachusetts. 30 cents for breakfast and 40 cents for lunch may still be a barrier for reduced price eligible families. It's worth repeating that when a student account goes into negative, the student may face school meal shaming or be denied the same meal other students receive. This further stigmatizes the child and erodes their willingness to go through the cafeteria in the future. If left unpaid, this debt is also harmful to school nutrition programs, for they must pay down this debt, go after families to receive those funds, or be bailed out by the district's general fund. This creates a no-cost cost barrier, but is a no-win situation for everyone. Our solution is simple. Every student should be able to receive a USDA reimbursable meal at no cost if they need or want it. This would allow us to remove the barrier of cost and greatly reduce the stigma around school meals. Schools who have adopted universal meals through CEP have reported they are able to bring costs down and revenue up thanks to increased participation. With these extra dollars, they can make investments in staff, equipment, training, and ingredients, all resulting in better school meals. Now I'll share how we plan to get to universal school meals through legislation. In order to bring about universal school meals, we are advocating for legislation making them a reality for all schools participating in the National School Lunch Program in Massachusetts. We are still actively looking for feedback before advocating for specific language, but we think there are at least 3 critical components needed to get us to universal. First, all schools would need to adopt the community eligibility provision, also known as CEP, if they are eligible. CEP is only for schools that meet a certain threshold of low-income students. Once adopted, it allows the school to provide universal school meals at no cost to families. All remaining schools would need to adopt Provision 2, which is another federal option for universal school meals. By adopting either provision, schools would still be in compliance with USDA rules. Second, the bill would direct the state of Massachusetts to cover the cost of meals not fully covered by the federal government. Only the highest need schools get 100% federal reimbursement under CEP. All other schools in CEP or Provision 2 must either control meal cost, use other school nutrition revenue, or other local funds to make up the gap. While we know many schools can make this work, we also know this financial gap is a barrier for many schools torn between wanting to adopt universal meals and their tight budgets. Controlling meal costs can also sometimes mean sacrificing quality. By providing state funds to make universal school meals a reality, we remove that barrier and we ensure that schools maintain or improve quality while serving meals to all students for free. Third, this bill would have a requirement that schools support SNAP outreach efforts. Families who enroll in SNAP receive free school meals and help increase the overall reimbursement rate under CEP or Provision 2 for their school. Increasing SNAP enrollment brings the total cost to the state down by maximizing federal reimbursement. This also benefits families by ensuring they receive SNAP benefits, helping them access food beyond the school day. We're still working on formal estimates of the projected impact of universal school meals. For using October 2019 data, we have outlined two potential scenarios. In the first scenario, labeled here as a smaller increase, we used the results of a 2013 USDA study. The study found that schools adopting universal school meals saw participation increase of over 9% for breakfast and over 5% for lunch. In this lower increase scenario, we assumed a similar increase for all schools not currently serving universal meals. In this scenario, over 5,600 more students would eat breakfast daily, and over 14,500 would eat lunch daily. As no state has adopted statewide universal school meals at this time, it is unclear just how big the impact may be in Massachusetts. For sake of argument, we estimated a 25% increase in participation across the board for breakfast and lunch. This is under the second scenario, labeled here as a larger increase. In this situation, 28,000 more students would eat breakfast and more than 110,000 additional students would eat school lunch. I want to stress that these initial estimates are just that, initial, and we ask they not be shared widely. We are still working to get better estimates with the help of many partners. I now pass this back to Jen to open up things for discussion.
Thanks so much, Liran. And before we open it up for discussion, I do just want to give a quick sense of what we see as what comes next. If you could go to the next slide, please. So we would love to invite everyone on this call to join the coalition. We do understand folks might have more questions even after this webinar, and hopefully we'll get to as many as we can. And so if you go to projectbread.org/USM, there is a sign up form to either join the coalition, which we would love for you to do. The coalition has not been created yet. We are currently working on, as Liran mentioned, the legislative piece. We're working on messaging. We're working on even just a name and the branding, and we want to have as many people on at that ground floor as possible. So you can go to that link either to sign up or to just indicate that you'd like to remain in contact and learn more as it goes forward without any commitment necessary at this time. So we would love for everyone to do that. We are tentatively holding December 15th for our first coalition meeting. We would love to have anyone join, whether you're ready to be an official member or not. In January, we will look to bill filing and filing actual legislation, as well as a public launch of the coalition that will be working around this issue. And then going forward, of course, we will have, you know, sort of the key pieces of building this legislative campaign together. So we intend to have a lobby day, to, you know, have legislative meetings and encourage co-sponsors to join on. And we want to do that with all of you. So that is sort of very high level of what we see coming up, and we'd love for you to join us. So if we could go to the next slide, please. So once again, you've seen this this screenshot on the second half, the bottom half there earlier in the presentation. This is just a reminder of how you can ask questions or raise your hand to speak and pose questions verbally. I also just want to point out, we have several questions. We would love to hear from you all. You know, we've been having meetings, one-on-one meetings with as many stakeholders as we possibly can over the past couple of weeks. Met with members from the school community representing teachers and superintendents and school nutrition professionals. We've met with members of the medical community, the anti-hunger and broader advocacy communities, we really want to make sure that we are trying to get as many perspectives as possible. And some of the things that we're trying to think about is, what do we need to make sure we're addressing in the bill language? It's been mentioned a couple of times, the issue of making sure that we're thinking about quality and that we're thinking about who we reach and how. And so what do we need to make sure? What resonates with you about this campaign, and what might give you pause that we can talk through? Who do we need at the table, and what can we do to make sure schools are promoting SNAP to maximize that federal reimbursement? What's the best way for us to address improving school meal quality, which I mentioned, and are there some questions we're not asking that we should be asking? So those are just to tee up some discussion, but we would really love to, we would love to hear what you have to say. I'm sorry, I'm seeing some questions come in, so thank you all so much for putting your questions in. I am going to, I'm going to toss the first one over to Erin. And Erin, I just want to make sure you're able to unmute. There you are. So we have a question here that says, what do you say to the question that we are inevitably going to get, that this is not necessary for a more advantaged community? So this idea that that there are some communities that might not need this.
Yeah, and we know we're going to get asked that question, and it's an important one to raise up. The reality is hunger exists in every single community, in every single school in Massachusetts. We also know that students who are struggling to afford food in those communities are less likely to participate because the stigma is so strong. I was one of those kids over 20 years ago in a community where, with the single mother, and we were facing economic hardship, and the stigma associated school meals was a barrier for me. So I think we need to walk away from the assumption that there's kids in certain communities that don't need this. We know there's kids across the state. And I would also say that that is going to be even more true in the next few years to come because of the impact of this crisis. And I'd also just add from an advocacy and anti-hunger standpoint, we've been taking this incremental approach for a long time. We've had the same system in place since after World War II. I was a child that experienced it over 20 years ago. We need to change it. The system's not working. And I think the notion that we continue to decide which kids deserve it, which kids don't, put up barriers to make that determination and that eligibility, it's not working. Too many kids in our state are going food insecure. And the long-term implications of that, you've heard enough about already today. So it's certainly going to be a question that we're going to continue to get asked. And I think we need to root it in our values and also root it in the facts that kids are food insecure in every single corner of the state.
Yes, thank you very much. We have one here that's a comment that I'm just gonna read, this says, would love to see some nod to the good food purchasing policy as part of the plan. City of Boston adopted it in 2019 and integrate equity, sustainable sourcing, local purchasing in the efforts. I'll just quickly say that, we really appreciate this comment. I think, as we mentioned, in terms of the quality discussion, we've had discussions about procurement and sort of how that sourcing comes into play, and we have great partners in sort of the food system space that we want to hear from, and we want to have these discussions. So I would certainly invite this discussion and to continue to have it offline to really think this through. But I don't know if Liran, you want to add anything, or if any of the other panelists want to add anything to this one.
Yeah, I can add, as Jen mentioned, we're still thinking through a lot of this and would love feedback. But we do see universal as a way to address quality. Some of the concerns around quality and why school meals aren't better, you can really attribute to the lack of time and resources in schools. We know that the federal reimbursement has just kind of it's been increased in incremental amounts each year, but it hasn't really kept up with cost of food, cost of labor, and certainly not the cost of living for the staff and workers who work in the food service space. So the first part is that we really believe that universal will help alleviate some of the administrative burden. There is a lot of time and energy that goes into just disseminating paper applications, getting those paper applications back, processing them, and then sorting kids in those different buckets of free, reduced price, and full paid meals. And then with that comes the burden of school meal debt, which is problematic in a number of ways, but is also an administrative cost that schools have been having to go after families to try to get those costs back. And we want to just make the statement that those departments should be focusing on their primary responsibility, and what most of them were hired and excited to do about their jobs is to feed kids and make sure that that energy is put into feeding kids the best quality meals. Then there's the second piece of it is just budget. And we know that that's a huge constraint. A lot of schools have done some really creative things. Our own chefs program has done some really wonderful work making sure that schools are making the best quality meals with the reimbursements they have. But no doubt about it, more money would be helpful. So with Universal, we know that participation will go up, and with that, revenue will go up. And that increased revenue can be reinvested into more staff, training, equipment, better ingredients, any number of things that can help that school produce better quality meals and to purchase better ingredients. And then finally, there is a little bit of a softer side of this. Of as participation goes up, we know more people will have a real stake and a real kind of will to see school meals be better. So we know that systemic solutions are going to be a big part of this puzzle, but also having the community involved in the school meal program and having more of those higher income families interested in what is happening in their school cafeteria will help make sure that we're having better quality meals. And so I think Universal can really address a lot of those concerns while also opening up a lot of access.
Great, thanks, Liran. And Chetna, I see your hand up. If you're able to unmute yourself.
Yes. So actually, I will very much similar to what Liran is saying. I've been wanting to share the same thought that the inequities. What I want to say is that inequities in our education system, period, is so much reflected in our food delivery system in school too, right? Because we are creating, in general, as we all have shared, all panelists have shared this here, is that we are creating a class system and we are promoting it by sort of putting our children in a category of income, and I think that is the first step. We need to remove that first barrier to actually move on to a better, well-balanced nutritious meal. So for example, from the perspective of Codman Academy as well, for the last 5 years, Codman has a very strict, very much to the T. We follow not only USDA guidelines for nutritious meals, but we have our own guidelines as well in terms of reducing, use of salt. We have a very strict no junk food policy on school campus. And as school nutrition staff or school kitchen staff, or even the school administrators are not worrying about, and I'm not talking about Codman because we do have that free, but studies after studies have shown that if school kitchen staff can be freed up, they will actually embrace more of the bigger vision, which I think also falls into farm to school category too, is that really figuring out where our food is coming from, what does nutritious meal really mean in terms of like local and regional sourcing. So so again, I really do think that this is a way to this is a step we should have taken a long time back, but it just to create that baseline equity on which to build on this whole idea of taking care of our climate or taking care of the food justice and racial justice issues. This all ties in. We cannot overlook the whole premise of racial inequities and racial inequalities without, we have to keep that in mind as we are also approaching or trying to support this universal school meals, that it really ties into that as well.
Thank you so much, Jenna. We have a question here that I can answer pretty quickly. How are youth being involved in this effort? I think this is a hugely important point to make. While we have been having our discussions, we reached out to other states that that have tried this. So one was Vermont. Vermont currently has legislation for universal school meals, and they specifically called out the youth engagement as being really important to the work that they've done. And we totally agree. These are the voices that will be impacted by this. So for sure, as we think about engaging various stakeholders and various voices, we want to make sure that we're engaging student groups and that youth piece as well. I'm going to toss over to Lyra on the next question, which is, what is the cost of this program? You addressed some of this in your remarks, but could you answer the specific one?
Sure. And as I was saying in my remarks about the participation, projected increase in participation, these are really some initial numbers, and we're really looking forward to working with some partners who we've already been in touch with to make better estimates. But that's a question we're getting a few times in this presentation. I know it's on top of everyone's minds, so I'll just get to it. We're projecting it's going to be somewhere over 100 million. It's about 100 million to 120 million based off of participation. Again, I stress that those are like initial numbers. So I would hope that everyone doesn't spread that far and wide and give us the chance to really do some more of our due diligence. But we know that as we mentioned before, this is a huge investment in not just food access, which is kind of our primary goal, but also investing in better school meals, investing in communities and in schools to be able to produce and pay staff and really support the work around school meals and not just the school meals themselves. So I think there's a lot of value in that investment the state would make. And we've, as Erin mentioned in the opening remarks, it's a lot of health benefits, a lot of educational benefits, but we know we'll pay a lot of dividends with that cost.
Great, thank you. Okay, we're getting some great comments and questions here. Here's one that came in that Liran, I think I'm going to toss to you again if you don't mind. But this is sort of in response to, I think, one of our questions. So some of this discussion back and forth, but can you talk a little more about what it would look like to have schools promote SNAP? And do you see a role for community partners?
Yeah, and I would be a little remiss not to mention the great victory yesterday of the SNAP Gap Amendment by Senator Saldi Domenico. Passed it, so it's going to be included in the Senate version of this year's budget, which would really help connect more people to SNAP. And that's a lot of the work that Project Bread's been doing around SNAP outreach with our food source hotline and a lot of our other work around SNAP. So we're really excited to use some of our experience and work with schools to figure out what they can be doing to increase access to SNAP. We know that it's not necessarily the right fit for every school to have a SNAP outreach staff person, but we do think there's a lot of opportunities for schools to promote resources like the Project Bread food source hotline. So that's something we're really looking forward to connecting with school stakeholders and other partners in the SNAP outreach space to really think through what are kind of the options for schools to be involved in promoting SNAP and really maximizing access to that benefit and with it access to the federal reimbursement for school meals. And Jen, keep me honest if I didn't answer a question fully.
Yeah, no, I think that's great. And I just want to mention that, Pat Baker from MLRI and Jamie Cloughs from NESW, I believe, are both on the call today, and they were just worked so hard on that SNAP Gap Amendment and the SNAP Gap for, effort broadly. So huge thank you to them and congratulations on that victory. Okay, next up we have one that I think, well, I'm just going to read it. It says, can you quantify the health and educational benefits of this program? And I think my quick answer is that there's a lot of great research and increasingly more and more research that does do that, that really looks at the long-term benefits to a person's health and education, and then how that ties into the economy. And that is all research that we want to really distill down. But if Erin or Liran have anything to add or anything more specific at this time, certainly open to, or Chetna as well.
Well, I'll say as one of our research folks, that's definitely something we'll be digging into, and I'm excited to do that. But also that's a great place if anybody else is interested in those topics or working on those topics, please get in touch, because the more evidence we can bring, and I think a lot of the folks on this call know the importance of school meals, the more evidence we can bring to the table, I think the more successful we'll be.
Right, I will agree with it. And I'm a big believer in collecting qualitative data from parents, because we can't, I think parents will be our biggest, most powerful advocates in this effort, and maybe even in this world of virtual life. I do think good focus groups from parents, and somebody made a very good comment about in this question and answer section that some parents, there may be a pushback from parents saying my children are consuming extra calories. And so like really hearing from what the parent or the families are actually seeing benefits and some of the sort of the shortcomings of it. And as I said, in this virtual world, it's sometimes easier to bring people together. They may be able to just log in from home. They don't have to get anywhere. And basically from all different communities of all socioeconomic background and all racial makeup and ethnic makeup. That's what will give us an idea of how much support is there within the households.
Yeah, and I would just add, the research is so important. I think we will be going through it and making sure that we're sharing it with the coalition. Example is research that was recently shared with us showed that students who actually eat the school meals are eating healthier than the meals that parents are sending from home. And I think that's a common misconception that folks would actually assume it was the reverse. But the truth is that kids that eat school meals are having a more nutritious meal. Another, going back to breakfast, is that was a concern that was raised around breakfast after the bell, and studies have shown that when breakfast is offered, it didn't consume the number of calories that kids were actually eating during the school day. So I think the research will be really important. I think what will be helpful for all of you is to lift up some of those questions, and we can see what research might be available to help answer it. And again, I totally agree with Chetna, having focus groups with parents and students and teachers around some of the concerns and coupling that with the work that we're doing.
So we have several more really great comments and questions. We are at 5 of, and we want to be able to wrap up. So we're going to be taking all of these down and reaching out, and we will continue to have these discussions, and we will bring a lot of these questions on to our coalition meeting in December, and just really want to continue this dialogue back and forth. So I will say, I think a lot of you have an email for one of us at Project Bread, but if you email actionteam@projectbread.org, it goes to both Liran and me, and we will make a time to chat. We would love to keep this discussion going. It's been hugely helpful. And Chetna, thank you so much for bringing your perspective to this discussion and these questions. I think it has been really helpful to hear from the view from a school that's doing it and what it has meant. So thank you. And so at this time, I will turn it over to Erin to wrap us up.
Thank you everyone so much for participating today with everything else that's going on in our country and in our state right now. I know how incredibly busy you are. I really appreciate you taking the time to listen, to ask questions. And again, we know that we'll only be successful based on the strength of our partners, the strength of our coalition. Also encourage you to ask those tough questions. Bring those to us so we can think them through, and also to think innovatively. I know there were a lot of questions in the comment box around local sourcing and local food, and those are conversations that we're having. And if you want to offer advice, I think we have an opportunity here to craft something that's unique to Massachusetts, which I think would be really critically important as well. So thank you for participating. I hope you'll consider joining us in this effort. And as Jen and Liran said, reach out to them if you have any questions, and be well, everyone. Thank you so much.
Thank you all. We look forward to working with you.
Thank you, everyone. Bye-bye.